Welcome to our ALS Learning Series webinar, Coping with Grief and Loss During COVID-19. I'm Nicole Sammartino, Community Education Manager with the Les Turner ALS Foundation. And I want to just make a quick note that we know that grief is a very personal topic and very individualized. And I would like to ask you to open your mind and your heart today and let yourself feel whatever feelings surface without judgment. Next slide. We're going to start out with a little introduction about the foundation, and then we're going to talk about COVID-19 and the impact that it's had on our lives, our mental and emotional health, how we grieve, the different stages and feelings we go through, some of the factors impacting the grief process, and we'll then discuss some coping techniques and self-care before we hand it over to Kathy Granfeld and Easton Stevenson, who will have an extremely powerful and real conversation about Kathy Granfeld losing her husband Ronnie to ALS in 2020. Kathy will share her compelling story about the feelings that she experienced and how our bereavement support groups were helpful in helping her process that grief. Next slide. At the Les Turner ALS Foundation, we realize that people living with ALS may feel overwhelmed and unsure of what questions to ask and what to do next. We exist to care for those affected by the disease, guide them to answers, support them and their loved ones, and provide hope through scientific research. Next slide. Our support services team is comprised of knowledgeable and compassionate nurses and social workers with many years of experience guiding people and their families affected by ALS. You can see from this slide a variety of services that we offer, including care visits by our ALS support services coordinators, support group meetings, which we'll be discussing at length today, educational materials and programs such as this one, and in-service education for community care. Those are just some of the programs and services that we offer. Next slide. Along came 2020. I'm sure many of you can share countless stories of how COVID-19 has impacted your lives and has really changed the way that you live your life. We certainly had to pivot at the foundation in terms of how we provide care and services to our patients and their family members. Next slide. We immediately contacted every person and family that we serve to determine their immediate needs. We launched a COVID-19 information and updates webpage and provided information not only about the coronavirus, but we provided information to address your respiratory concerns. We immediately pulled our support services team members from in-home visits and in-person support groups to the virtual setting. Lastly, we established COVID-19 emergency fund campaign for those basic needs that our families had, including monies for medications and groceries, Next slide. We then had to make some programmatic changes, which you probably have noticed. We redefined our home support visit program to include more frequent check-ins. So we've really increased the amount of touch points and check-ins that we have with our families as a result of COVID. We added a therapeutic bereavement support program to address losses during COVID. And we expanded our Celebration of Life program to a virtual platform with a reach of 3,000 people. And we'll talk a little bit more about Celebration of Life later on in the presentation. Lastly, we launched our new ALS Learning Series, which you're participating in today. Next slide. I'll get us started off, and then I'll hand the presentation over to Easton Stevenson for her conversation with Kathy. But I want to ask you, please take some notes, send me your questions, send me your comments. I want to hear what resonated with you today. Next slide. Studies indicate that COVID-19 has had a significant negative impact on our mental and emotional health. And the evidence is overwhelming across race, socioeconomic status, and geographical location. The main presenting issues include stress, anxiety, fear, anger, grief, and depression. So you may have experienced some of these or all of these. The inability to visit with family and friends, the countless canceled plans that we experienced creates a great deal of stress. We all experience anxiety and fear of getting COVID, and maybe even had some anger over how disruptive COVID has been to our life. The grief and depression is palpable for so many that have been isolating in their homes. Next slide. Let's talk a little bit more about the stress and anxiety that we experienced as a result of the pandemic. You'll notice on this slide that it lists the populations that were more impacted by the pandemic and the stress and anxiety associated. So you'll see high-risk populations, children and teens, people who abuse substances, racial and minority groups. But I want you to notice that I highlighted on this slide, people caring for family members or loved ones experienced higher levels of stress and anxiety. The results from limited studies that we do have on grief and ALS confirm that no caregivers are challenged more than those of people with ALS. So that's just something that probably affirms and confirms what you've been feeling already. Next slide. We also know that stress and anxiety, when experienced above normal levels in duration, lowers the immune system. So I think we have to keep in mind how it's impacting our physical health. And we'll talk about some healthy techniques in addressing our anxiety in a healthy way in a little bit. Next slide. So let's define some key terms. Grief is the very personal, emotional process of reacting to the death of a loved one. And I ask you, how will you respond to it? Will you look it in the eyes or will you sweep it under the rug? Someone told me when I was a bereavement counselor many years ago at a local hospice, what you look at disappears. So I encourage you to look grief in the eyes at the same equal playing field and acknowledge it and make friends with it, because what you look at disappears. You then diminish the power that grief has on you when you acknowledge it. Our mourning, that emphasizes the public expression of grief, such as funerals, wakes, shiva, celebrations, and gatherings. These are all influenced by one's beliefs, religious practices, and cultural context. Our way of mourning has been greatly disrupted by the pandemic. And I'm sure some of you have stories you could share about how that's been sort of an interruption of your grief, or sort of halted your ability to grieve in a way that you would have. And then bereavement, the objective situation one faces after having lost an important person via death. And that's what we're going to be focusing on mostly today. Next slide. I thought it was important to make mention of the inherent loss that is an aspect of ALS. Throughout the lifespan of a person living with ALS, many losses will occur, whether they're physical losses or potentially cognitive losses as well. So some examples of losses experienced by those living with ALS include loss of function, loss of independence, employment, loss of roles within the family. You may have once been a husband or a wife, and now you're a caregiver. But also really important is to mention that grief doesn't always start after the death of a loved one. It can begin when our loved ones begin to experience symptoms, or during the diagnostic process, and or confirmation of diagnosis, which can sometimes take a long time. One of our bereavement support group participants said, "When asked when my grief started, I told people that it didn't start the day my husband died. It started 3.5 years ago when he started to have symptoms, and then again 2.5 years ago when he was diagnosed. So that's just something to keep in mind. Next slide. Now let's talk about the 5 stages of grief. Denial, bargaining, anger, despair, and acceptance. And I purposely had this slide created in a circular fashion to convey that there really is no order to the 5 stages of grief and how you go through them. You may start with denial, you may then go to anger, and then back to denial. So there's no order and there's no specific amount of time that you would stay in one stage. So please know that the stages are meant to be descriptive and not prescriptive. This is a very individual experience and journey, and grief is much more fluid, like a roller coaster. Next slide. So what common feelings do you recall, and how did you support yourself in your time of grief? In this graphic are a variety of different feelings that are very common that you may or may not have experienced. A lot of times I hear people experience feelings of guilt, and a lot of that has to do with the fact that they maybe weren't in the room when their loved one died. Maybe an expression of anger. Someone can be angry at the disease, the person, or themselves, or healthcare providers. Also, trouble thinking or concentrating, loss of appetite, weight loss, perhaps some social withdrawal. And I think the social withdrawal really is about self-preserving what energy you even have for yourself from such an exhausting grief process. Next slide. Listed on this slide are some unexpected but healthy feelings that may arise during the grieving process. And we listed those on the previous slide too, but I thought it was really important to draw them out and bring those to your attention. Many of you perhaps felt relief of the 24/7 caregiving and related fatigue, the unpredictability of ALS, and the uncertainty around the timing of the death. Surprise as well. You know, we may be anticipating the loss of a loved one who has ALS, but the actual finality of losing that loved one can be quite startling. So something just to be aware of. And again, like I said in the prior slide, you might feel a sense of anger at the person, the disease, at yourself, or other people who still have their loved ones. And then denial. Denial is really a hallmark of the grieving process. We really have a difficult time accepting the reality of the loss. We just can't believe that our loved one is gone. In addition to these unexpected but healthy feelings, people who are grieving often report that they have dreams of the deceased and or they are still searching for causes related to the diagnosis and death. Next slide. There are many factors that impact our grief response, starting with our history of our grief. How have we grieved previous losses? Did we deal with them effectively, or did we, or was it very traumatic and we tried to deny that and not address our grief? So really, how you grieved in the past will determine how you grieve today. Certainly, we all have different personality types, different ways of grieving based on our personality, our coping skills. Our relationship to the deceased is extremely powerful. Was this someone that you knew as an acquaintance, or was this your husband or another family member? Support networks. Do you have any people that you can rely on? Who do you go to when you need to be in a safe space, in a non-judgmental space, to feel like you're being supported? What are those support networks? How the person died certainly impacts our grief response. Was it expected versus sudden? Was it directly tied to ALS or other causes? And again, did your loved one die alone, or were they surrounded by family and friends? What was the age at the time of death? What stage of life was your loved one in when they died? Were they at the end of their life? Were they at the end of their stage of life? Or were they at the middle of their stage of life with young children? And then lastly, did your loved one have cognitive and or behavioral impairment, including frontal temporal lobe dementia? Sometimes people tell us that they experienced 2 deaths, the figurative death of the person that they once knew, and then the physical death of the person. So some other factors that impacted our grief response during the pandemic included family members haven't been able to go to the hospital to visit their loved ones. Loved ones may have died in the hospital without anyone around them. You may not have been able to have a funeral or a memorial service due to social distancing. And lastly, in some cases, healthcare professionals took the place of family members in providing comfort and support to your loved ones. Complicated grief can keep you from healing. And there's really not a difference between what you feel when your grief is complicated and when it's healthy. The difference is when you experience healthy grief symptoms, your symptoms gradually fade over time. Those of complicated grief linger, increase in severity, and or impact your daily functioning. So it may impact your ability to go back to work or care for your grandchildren or your children. So something to be aware of. If left unaddressed, complicated grief can have some serious results, such as depression, suicidal thoughts, anxiety, increased risk of physical illness, or increased use of substances, alcohol, nicotine, or other substance abuse. So I encourage you, if you're experiencing grief that continues to linger, is increasing in severity, or is impacting your daily functioning, it's really important that you consult with a professional. Next slide. Our expression of grief, was impacted during COVID-19. We express our grief in a public way and in a private way. And we know publicly the importance of symbolism, of rituals when we lose a loved one, such as large gatherings, funerals, wakes, Shiva. In the absence of such gatherings and rituals, we are confronted with grieving without as much external support. So think about what that was like for you. Privately, some people shared with us from our bereavement support group that it was an opportunity for them because they appreciated the privacy to grieve on their own terms and timeline. Others told us that it was more of a hardship. Others that they felt increased sense of isolation and lack of support. So again, everyone's different in terms of how they grieve and that private expression and public expression and what that was like for them. Next slide. Now we've talked about the impact that the pandemic has had on our grief. We've talked about some feelings around grief. And now we're going to talk about some individual techniques in coping with the loss of a loved one during a pandemic. Excuse me. Seek out peer support to receive validation, affirmation, and normalization of your feelings. Who are your support networks? Do you have people at church, at work? There may be an employment EAP program, employment assistance program. People in your community, your neighbors, family and friends. You may even be able to find some peer-led support groups of people that went through exactly what you're going through right now. It's important to maintain your personal health, your physical, your emotional, and your psychological well-being. What ways can you do that? And then the practice of self-care. What does this look like to you? And we're going to talk about that in the next slide. But I want to mention that research shows that while professional support is important, more social, informal support is absolutely critical. And that's what this slide is focusing on. Next slide. This picture really sums up why it's so important to practice self-care. You can't pour from an empty cup. When you fill your cup up, you have enough to give to others. And as a matter of fact, when you let your cup runneth over, all of that extra goes to others. As the quote says, self-care encourages you to maintain a healthy relationship with yourself so that you can transmit the good feelings to others. You cannot give to others what you don't have yourself. Next slide. I love this graphic because in the age of cell phones, we all have one. We would never want our battery to die, right? That would be awful. So it's really important not to let this happen to you either. I would ask you to pay attention to your physical health, eating healthy, and even if you can't exercise, some type of movement. Getting enough sleep. What would that look like to you? Would it mean increasing your sleep by an hour or two a night? And really, this whole process is about identifying what matters to you. This should really guide and determine your approach to living. Ask yourself, what can I do more or less of? Can I get back to more journaling or crocheting or sewing or painting? Something that you really had to put on hold as a caregiver. Would you like to do less of something that hasn't been healthy? Maybe smoking or something like that you'd like to improve your health a little more. The third bullet is to ask for and accept help when necessary. And this is really, really important because I think we're all really good at giving to others, but we're not so good at accepting help. So just as you graciously give, you have to learn how to graciously accept as well. And then the last bullet point is giving yourself an opportunity for hope and joy. Show yourself some compassion and patience and ask yourself how I'm talking to myself. Would I talk to a friend the way that I'm talking to myself? So how would you support and comfort a friend who is going through a loss? And can you do that for yourself as well? Interaction with others. Interact with others who get it, who really understand and can be present with you in a non-judgmental way. And then these last 2 points are really powerful. A belief that things will get better. You know, I think we're all familiar with the quote, I'll believe it when I see it, okay? But you have to believe it first. I will believe it and then I'll see it. It's really, really important. And then invite your grief to dinner. And what I mean by that is, as a bereavement counselor in the past, I counseled countless individuals and families that said to me that they could feel that their grief was persistent. And someone said to me that it kept knocking at the door. And I said, well, why don't you invite it to dinner? Make friends with it, address it, confront it, greet it. That allows you to process your grief and become stronger. Next slide. So we talked about some individual techniques that you can employ to help yourself grieve. I also want to talk about some professional resources as well. Individual and family therapy is something that you can do to process your feelings and process the meaning around the loss of your loved one. It's a safe space and it's a non-judgmental space. And it's a place where you can have your feelings normalized. Bereavement support groups do the same thing. We're lucky that we are able to offer 2 bereavement support groups to the families that we serve. I'm going to tell you a little bit about those in a minute, but I want to say that research has told us that bereavement groups reduce depression, anxiety, fatigue, loneliness, and isolation. So let me tell you a little bit about those 2 groups that we offer. Next slide. Our first group is called our Moving Forward After Loss group. It's an 8-week bereavement group for spouses or partners of people who have died from ALS within the past 6 months. And then our next group is our Living After Loss group, which is our monthly bereavement group for those who have lost their spouse or partner to ALS and who have already attended the initial support group, the Moving Forward After Loss. Both groups will provide support, validation, and education in a supportive setting to those who are grieving the loss of their loved ones. And if you're interested in attending one or both of these groups, please contact Easton Stevenson at 847-679-3311. Please note that space is limited due to the nature of these groups. Next slide. And to wrap up our presentation, I wanted to go over the 5 things to know about processing loss and cultivating a healthy relationship with your grief. The first one is to be with your grief. Find a place where you can be present with it rather than in resistance to it. Number two, grief is a lifelong journey. And just like I said, to invite your grief to dinner, I like to say, hello, grief. I don't want you to be here, but I'm going to make friends with you because I know you're not going away. So come and sit with me and I'll be your friend. That's how you heal. That's how grief strengthens you. Number three, grief needs expression. Paint, sculpt, throw clay, journal, bake, sew, whatever feels right to you. What's so important is that you're able to share your story. Your story needs to be heard. Number four, healthy grieving involves ping-ponging between loss and restoration. So you wake up, you're not feeling well, you're sad, you're crying, and then you decide to go for a walk, and that's restoration. So you ping-pong between loss and restoration. You're not feeling well, but you do something good for yourself and to restore your feelings. And if you can find that balance between the two, you're going to be okay. Just know that that's healthy and that's normal. And the last one is that grief can break you open to a new you if you let it. Grief is supposed to change you if you let it. It can be a life-changing process that brings new passions and sometimes an entirely new direction in your life. So be open to it and be patient, compassionate with yourself, and the Les Turner ALS Foundation will be with you every step of the way. Now I'm going to transition the presentation to Easton Stevenson and Kathy Granfeld. As I shared earlier, Kathy lost her husband Ronnie to ALS in 2020. Kathy and Easton will share a real exchange of Kathy sharing what feelings she experienced after she lost Ronnie. And she'll talk a little bit about how our bereavement support groups helped her with her grief and her loss. A little bit about Easton. Easton's a Chicago native. She received her master's degree in social work from the University of Chicago in 2000. For much of her social work career, she's been supporting adults and children who have experienced various types of loss. After getting her master's degree, Easton worked with the HIV positive population in Chicago and with children in the foster care system. While at the Les Turner ALS Foundation for the past 7.5 years, Easton has been an ALS support services coordinator working with adults who have been diagnosed with ALS by providing intensive case management, supportive counseling and guidance to planning the end of their life through conversations and documentation. In addition, she coordinates the support group program for the foundation, which currently includes 4 support groups for people living with ALS and their family members and caregivers, 1 therapeutic bereavement group for widows, widowers, and 2 separate bereavement groups.
Good afternoon, Kathy. So nice to see you.
Nice to see you.
I hope that you and your family are doing well and keeping warm.
Yeah, trying to, like the rest of us.
Exactly. So today in our webinar, we've been presenting some information about people having experienced the loss of a spouse or partner due to ALS, and then having to grieve that loss during the pandemic. So I know that you lost your husband, Ronnie, on February 27th of 2020. So just a few weeks before the pandemic existed here in the United States. Can you tell us a little bit about Ronnie? What kind of person he was?
Very easygoing, very obviously very loving, fun, live life to the fullest, very active. As we both were, fishermen, and loved music, and we both love music, but just living the life to the fullest, the best that, he could, or we could, however you want to state it. But yes, to the fullest, and just a fun, he made friends everywhere,
Yeah.
everywhere. He made friends. I'm like, okay.
He sounds like a adventurous and personable guy.
Yeah, we were both our personalities were kind of pretty much the same. Pretty much the same. I think maybe being born on the same day, maybe. I don't know.
You were born on the same day?
Yes,
Oh
yes,
my
me,
goodness.
my husband, and my father-in-law. So
That's a lot
maybe
of
that has
birthdays.
something to do with that. I don't know. Who knows?
And do you recall what feelings you had just after Ronnie passed and since Ronnie has passed?
Well, you know, why? Anger, lonely, obviously sad, the loss. But I think I was relieved for him that he wasn't suffering, and not necessarily pain, but I think because his mind was there. And I think the pain comes into place because he knew his body was declining, but his mind was there. So I think the relief that he's out of that pain.
Mhm.
And I think that was very painful for Ronnie.
Yeah,
And me too.
of course, of course. And I think those are really common feelings to experience. And one which might be a surprise to people is the relief. The relief. What was the support like for you after Ronnie passed? Were you able to lean on friends or family members?
Yes, absolutely. My obviously my daughter Ashley, my son Ronald, and my sisters, my sister-in-laws, close friends, my co-workers that I used to work with, and of course you, Easton. Of course you. So you came into play a lot. So I think everybody had a good help in my grieving. You know what?
Mhm.
Everybody had a little part,
Yeah,
and that little part made it better.
sure.
Not bring Ronnie back, but everybody had a part to help me.
Okay. And did you find that there were any challenges or any difficulties with the family members, for example, supporting you as compared to somebody outside the family?
I think sometimes family uh, maybe don't get all of it, or they do or they don't, and maybe sometimes a professional, but sometimes they don't get 1 through 10 or A through Z, and
Mhm.
maybe a professional could pick up the 1 through 2, 2 through whatever, something in those, like, not necessarily they are not knowledgeable enough, but I think sometimes reading between the lines.
Mhm.
You know what I mean?
Yeah,
I think that, I think sometimes a professional could pick up, and also a family member could pick up too. So,
sure. Sure. And I'm wondering if maybe sometimes what comes into play is the relationship that family members had to the deceased, and whether that plays into that ability to pick up on things or the ability to help in the best way possible. Sometimes that's easier, sometimes that's harder, being a family member as compared
yep,
to somebody on the outside.
absolutely.
Okay.
Absolutely.
Okay. And so I know that you decided some months after Ronnie's passing to join the Les Turner ALS Foundation's Moving Forward After Loss weekly bereavement group.
Mm.
Can you tell us a little bit about your experience with that group?
Well, for me personally, it's been very helpful, to the point, not that family wouldn't help or support, but someone that's gone through this in a different maybe way, like just talking to someone that actually, maybe experience, or a husband and wife or spouse or whatever it may be, child, whatever it may be. I don't know. It's really hard to, I think it's just, I think it's just helpful.
Mhm.
I think it's just helpful to talk to somebody that has lost a spouse or a mother, father, sister, brother, whatever it may be. And no other disease is any better. I'm not saying that, but I knew everybody knows the end result.
Yeah. And had you ever attended a support group prior to attending the Moving Forward After Loss group?
No.
Okay.
No.
So it sounds like maybe one of the greatest benefits was being able to talk with people who had a similar experience that you had with Ronnie.
Absolutely. Absolutely. Yes.
And you're now attending the Living After Loss group, which is sort of a continuation from the Moving Forward After Loss. Tell us a little bit about that group.
It's just very helpful because it's like your inner feelings are, you're expressing your inner feelings to another person that's gone through this.
Mhm.
And it's nothing to be ashamed of. Not at all. It's nothing to be ashamed of, or, you're just reaching out and they're
Mhm.
reaching back to you. And there's nothing wrong with that.
Yeah.
That's a wonderful thing that you could reach out and feel good about yourself, that you said, I need to reach out to somebody, and that other person is reaching back to me.
Mhm. And so it sounds like being in a group, whether it's either of the two groups that you've attended and are attending, that's sort of that allows you to have that outreach to them.
Absolutely, yes. Mhm.
And you meet regularly, I'm assuming, with everybody as well, yes?
Yes.
Okay, great. And would you recommend these groups for others who have lost their spouse or their partner to ALS?
Well, yeah, I can't speak for anybody else, Easton. You know what I mean? For me, it was very helpful. Um, but you know what? It's baby steps. Sometimes you just can't jump into the pool.
Mm-hmm.
Sometimes you just have to take that baby step, and maybe you'll get through that next step. Not necessarily today, maybe not next week, maybe not next month. And that's perfectly fine.
Yeah.
Everybody is different. You don't need someone to tell you that you have to do this. You have to want to do this and feel good about yourself doing it. You
Mm-hmm.
want to feel good about yourself. And if you could help somebody to go into these support groups to help them, that's a wonderful thing. That's a wonderful thing.
Yeah.
It's not a negative thing. It's just to get them in those steps if they want them steps.
Yeah. Yeah. And when somebody believes that they're ready to take that step, do you think that joining a group such as the Moving Forward After Loss would be a good first step to take?
I would say yes, because they're making that first step,
Mm-hmm.
and maybe they'll take 10 back.
Yeah.
But you'll never know unless you try.
That's true. That's true. And as you've mentioned, it's the idea that you will then have the support and validation and understanding of other people who truly can appreciate what you've been through because they've been through something similar. And you wouldn't necessarily get that from family members, from friends on the outside. So in that way, a support group might be helpful if somebody feels that they're ready to do so.
Right. Absolutely.
Okay. What would you say to others who've lost a loved one from ALS or any other condition during the pandemic? Anything in particular you would suggest or advise during this difficult time?
Reach out. That's what we're all here for,
Mhm.
to help each other in this period of our life.
Yeah. Well, Kathy, I think you hit it on the head right there, that none of us without that benefit. right? And that we could all use a friend, we could all use somebody to talk to, and what a gift that is, to receive yourself and to give to others. And it's obvious that you've had that experience, and I'm so glad for you because of that.
Thank you.
You're welcome. Well, Kathy, thank you so much for sharing your story with us today.
Thank you. Thank you.
We really appreciate it. And
Oh, no, it was a pleasure. It's, you know, it's an honor and a pleasure. If I could do a little better for someone in this thing we're all going through, or the fact with the ALS, or the littlest thing could be a million to somebody.
That is true. That is true.
It's always been my honor and my pleasure.
Well, thank you.
Thank you, Easton and Kathy, for sharing such a personal and powerful perspective about losing a loved one. We really appreciate it. So please join us for our celebration of life to remember your loved ones lost to ALS. This will be a virtual event happening on June 12th, 2021 via Facebook Live. Next slide. We'd also like to invite you to our upcoming webinar in March, Talking with Children about ALS. Melinda Cavanaugh will be joining us on Thursday, March 25th at noon. Next slide. Lastly, we would like to invite you to our 2021 Hope Through Caring Gala, taking place virtually on Saturday, March 20th at 7 p.m. We will be honoring two remarkable individuals who are part of our ALS family, Bob Ives and Steve Gleason. For more information and to purchase tickets, visit hopethroughcaring.org. It's going to be an incredible night that you will not want to miss, so please join us. It's been my pleasure to spend time with you today. Stay in touch with us, and please take a few minutes to fill out our participant survey that you will be receiving at the close of this webinar. Your feedback makes a difference in the programming that we provide. Special thanks to Ryan Waters, our social work intern from the University of Chicago, for his contribution to this presentation. And don't forget, send me your comments, your questions, and I want to hear what resonated with you today at nsammartino@lesturnerals.org. Thank you and have a great rest of your week.